Today's topic will be on growth of a child. Growth of a child refers to the physical, mental, emotional and social development which they experience from birth till adolescence. Growth typically occurs in stages and which is influenced by genetics, nutrition, environment and health care. So today we will be discussing in detail about all this, and in short we will also talk on ICP model of growth. So in this picture you can see a child learns how to sit, then crawl, then stand, then walk, then stand in 1 feet, hop, jump and run. So this way the curve is followed, and this pattern is followed in the same way by every individuals. If you have to define growth, this means it is net increase in the size or mass of tissue, and this is quantitative. Quantitative means which is measurable. For example, weight, height, OFC, that is occipitofrontal circumference or also known as head circumference. Then velocity of growth of length, weight, height is there, and this is rapid during the last 3 months of gestation and first 4 to 5 months after birth. This is an example of height velocity. So if you look at the height, a child grows very rapidly during the initial phase of life, during infancy, and then slowly it becomes static, and growth remains static from 5 years till puberty age, and at puberty there is another growth spurt during the puberty age. So this curve is followed for height velocity. So similarly there is velocity for weight and head circumference also. Now come to factors affecting growth. We start with the genetic factors. Phenotypically, tall parents give birth to tall children, and short parents may have short children. That is many times. And parents with high IQ also may give birth to children who are having high intelligence. The genotype of the embryo itself is also important. So genetically, if the child is having abnormal chromosomal numbers, then the child may have retarded growth. Example is Down syndrome, where the child is physically as well as mentally retarded. Another example is mutations occurring in genes. So this is usually seen in all the different inborn error of metabolisms. So one good example is phenylketonuria, others can be galactosemia, glycogen storage disease, and there are many more. We will be discussing in detail about these diseases when I talk on genetic classes. Biorhythm, this is another genetic factor. So here, if the puberty starts earlier in the mother, for example, menarche starting early in the mother, child may also start her menarche in the early age. If the father has a delayed puberty, then the son may also follow the same pattern and have a delayed puberty. So this is known as biorhythm. Another factor affecting growth is sex. In this we can see males are heavier and bigger than the girls. Another factor is race, where based on the different cultural practice and then the different nutrition habits, there may be different type of growth, or growth may be affected due to all those factors. Now come to environmental factors. This is divided into prenatal factors, that it means before birth, and postnatal factors, that will be after birth. So before birth, prenatally, maternal, placental and then fetal factors are responsible for growth. So maternal factors, general health of the mother is very important. If there is nutritional anemia, severe malnutrition in the mother, baby may have a retarded growth. Systemic disorders like chronic illnesses in the mother, chronic illness like bronchial asthma, chronic kidney disease, chronic heart, congenital or chronic any other heart diseases may affect the growth in the fetus. Torch infections in the mother. So torch, it is T stands for toxoplasmosis, R rubella, C is cytomegalovirus, H is herpes virus, and O stands for others. Others includes HIV and hepatitis and tuberculosis and other conditions which may be transmitted vertically. Pregnancy-induced hypertension, maternal diabetes are other factors. Exposure to radiations and drugs during the pregnancy, and if the mother is having hypothyroidism, then there is chances that fetus may also have a hypothyroidism, and many obstetrical complications are also responsible for affecting growth. Placental anomalies like malposition in the uterus, faulty placental implantation are another placental factors. And if placenta is infected with the TORCH infection, then also there is retarded growth. In the fetus, if the fetus is having a congenital anomalies, if there is twins or triplet fetuses, premature babies or IUGR is intrauterine growth restriction. So if all these factors are there in the fetus, growth may be affected. Now come to postnatal factors, that is after birth. This is divided into host, environment and agent. So this we are going to discuss individually. We start with host. Here neonatal phase and children phase. There are two phases. So neonatal risk factors will be low birth weight, premature babies, IUGR babies, neonatal seizures or any other neonatal infections. And in children, nutritional factors are main. So deficiency of iron, iodine, vitamin and then protein energy malnutrition are different nutritional factors which affect growth. Immunity of the child is again important. If the child is having low immunity, then there is chances of having recurrent infections, and then these infections may affect the growth of the child. Environmental factors, socioeconomic status like poverty, illiteracy, negligence, large families, scarcity of food are different socioeconomic factors which affects growth. Many times emotional deprivation also affects growth. So examples are broken family, single parent, sibling rivalry and violence and abuse. Different cultural factors and beliefs, superstitions are also responsible for affecting growth. Climate, during the spring there is a higher growth, and during summer the growth is low. Now come to agents. Exposure to different agents like physical stress, chemical agent like lead, mercury, hormonal influence like thyroxine, growth hormone, insulin, infectious agents, persistent diarrhea, respiratory tract infection, meningitis, encephalitis, cerebral malaria and infestations of different worms. And trauma, fracture of the end of the long bones, which mainly affects the growing epiphysis, may affect the growth of a child. Now let's move on to ICP model of growth. I stands for infancy, C is childhood and P is puberty. This model refers to three phases of growth in human development: infancy phase, childhood phase and puberty phase, and this provides framework for understanding normal growth pattern and diagnosing growth related disorders. Come to infancy phase. Infancy phase means children less than 1 year age. Here nutritional factor is predominating the growth, which is influencing the growth of a child. Other influencing factors will be hormones like insulin and thyroid. And this phase is less dependent on growth hormone. When we say growth, we think growth hormone is mainly responsible for growth, but it is not like that. During the infancy phase, predominating factor will be nutritional status, followed by insulin and thyroid hormone, then only the action of growth hormone comes. As the child grows, reaches childhood, that is, childhood begins at 1 year of age and then it lasts till puberty. Puberty for girls starts at 8 years and for the boys 9 years. So during this phase, the growth hormone and insulin like growth factor 1 predominate the growth of a child. Growth hormone primarily stimulates the production of insulin-like growth factor 1, and this insulin-like growth factor 1 is stimulating the growth of the bone and tissue. And during this phase, other contributing hormones will be thyroid hormone and insulin. The growth is steady from around 4-5 years till puberty. Annually increment is only 5 to 7 centimeter per year at this period. Third phase comes the puberty phase, when there is a growth spurt, and this growth spurt is triggered by surge of sex steroids, mainly the testosterone and estrogen. Growth spurt means during that phase there is sudden increase of height of a child by some centimeters, and also the growth hormone helps in the growth during this phase. So during the puberty phase, main hormone will be the sex steroids followed by growth hormone. Okay, so this is a chart showing ICP model of growth. This graph is showing ICP model of growth, where you can see intrauterine life, maternal placental factors are mainly affecting. During infancy, nutrition status of a child is the predominating factor which affects growth, and during childhood, growth hormone is the main affecting factor, and during puberty, sex steroid followed by growth hormone will be the main factors affecting the growth of a child. Thank you. I'll come up again in the next class with other parameters of growth.